What is the difference between a UTI and a bladder infection? Have you ever wondered what sets a urinary tract infection apart from a bladder infection? Understanding this difference can help you recognize symptoms and seek the right treatment. A urinary tract infection, commonly known as UTI, is a broad term. It refers to an infection that can happen anywhere in the urinary system. This includes the kidneys, ureters, bladder, and urethra. On the other hand, a bladder infection is a specific type of UTI that affects only the bladder. Medically, this condition is referred to as cystitis. When we talk about UTIs, we are discussing infections that can occur in any part of the urinary system. Most of the time, these infections begin when bacteria, particularly Escherichia coli, enter the urinary tract through the urethra and start to multiply. Symptoms of a UTI can vary based on where the infection is located. Common symptoms include a burning sensation during urination, a frequent urge to urinate, cloudy or foul-smelling urine, and sometimes even fever. Now let's focus on bladder infections or cystitis. This type of infection is localized and specifically involves inflammation of the bladder. It is the most common form of UTI. Symptoms usually include needing to urinate often, a strong urge to go, discomfort in the lower abdomen, burning during urination, and occasionally blood in the urine. Unlike UTIs that affect the kidneys, bladder infections typically do not cause high fever or severe systemic symptoms unless the infection spreads. It is important to distinguish between these because bladder infections are usually less severe. However, if left untreated, they can lead to more serious conditions like kidney infections, which requiring more aggressive treatment. Chronic or recurrent bladder infections can also pose risks for bladder health. While these infections themselves do not directly cause bladder cancer, persistent inflammation of the bladder lining is a recognized risk factor for changes in bladder tissue that may contribute to cancer development over time. In conclusion, the key difference is that a bladder infection is a specific type of UTI that is confined to the bladder, while a UTI can affect any part of the urinary tract. Both conditions requiring medical evaluation and treatment to prevent complications and maintain bladder health. If you experience symptoms of a UTI or bladder infection, it is essential to consult a healthcare professional for appropriate diagnosis and care.